This training presentation will focus on hazards you might encounter while working in a healthcare facility and the best ways to avoid them. I think we all know, though, that even in the most compliant workplaces, accidents can still happen. Healthcare workers face a number of serious safety and health hazards. This includes bloodborne pathogens and biological hazards, potential chemical exposures, respiratory hazards, ergonomic hazards from lifting and repetitive tasks, laser hazards, workplace violence, hazards associated with laboratories, and X-ray hazards. Fortunately, you have an employer that wants to provide a safe workplace, so it's important to communicate if you have any questions or safety concerns. Make sure you know who your safety and health officer is. They're the person that you talk to if you have any safety issues or in the event of an injury. The majority of our training will focus on Osha standards, like the Bloodborne Pathogen Standard or the Hazard Communication Standard, but sometimes hazards exist in a gray area or outside of a direct standard. Enter the General Duty Clause. Under this catch-all clause, an employer has an obligation to protect you from workplace hazards even when there isn't a standard. Preventing workplace violence is a perfect example. No standard, but a general duty under Section 5, Subsection A, Paragraph 1 of the Occupational Safety and Health Act of 1970. Employers aren't the only ones with responsibilities, though. You have an obligation too, and basically, that's to follow the policies and regulations outlined in your OSHA manual. This red book, or one like it, is your OSHA manual. It's important to know where it's at in your facility. Although most people don't, you have the right to access these safety policies anytime during business hours. In the event of an inspection, it's critical that you know where it's at to provide timely access to the policies and training records. You should also be familiar with the federal OSHA poster. This poster, or a state equivalent, needs to be displayed somewhere in your facility. It's a summary of the Occupational Safety and Health Act of 1970 and explains your rights to have a safe workplace. When we use the term general compliance, we're referring to hazards that aren't necessarily a result of working in a healthcare facility. These types of hazards, like fires, workplace violence, and natural disasters, can impact the safety of all employees, regardless if they see patients or they don't. For that reason, every employee should be included in this training and should sign the employee training records. We can go into depth on the fundamentals, but it's important that everyone knows the site-specific details and locations within your facility. Although a fire is unlikely, the best way to protect yourself is to be prepared. You should make a mental note of locations like exits, stairwells, and fire extinguishers in your work area. The most important one, though, is the exits. If you haven't been designated and trained, or you're unsure of your abilities, or you're scared, evacuate immediately and head to your assembly area. This area has been pre-selected, and it's usually a recognizable spot that's a safe distance away from your building. If you're unsure where your assembly area is, talk to a supervisor or your safety and health officer. On the other hand, if it can be done safely and you have to use a fire extinguisher, they're very effective against small fires if they're used correctly. Before anything, sound the fire alarm and call the fire department if it's appropriate. Identify a safe evacuation path before approaching the fire. Don't allow the fire, heat, or smoke to come between you and your evacuation path. Select the appropriate type of extinguisher. Most are going to be designated ABC, and they're going to be suitable for fires in healthcare and dental facilities. This would include paper, wood, combustible liquids, and electrical fires. Discharge the extinguisher within its effective range using the pass technique. Back away from the extinguished fire in case it flares up again, and if the fire is not out and your fire extinguisher is empty, evacuate immediately. Most extinguishers operate using the following pass technique. Pull, you pull the pin. Aim low, pointing the extinguisher nozzle at the base of the fire. Squeeze the handle to release the extinguishing agent, and sweep from side to side at the base of the fire. Watch the area and be prepared if it reignites. Once again, if you have any doubt about your abilities to fight a fire, evacuate immediately. Your employer has established policies for natural disasters that could occur in your area. Most occur during certain times of the year, and they allow for some preparations, but others can occur swiftly and with no warning. In the event of a reasonably predictable disaster like a hurricane, arrangements can be made to shut down or alter business hours if necessary. Regions that are susceptible to unpredictable events like earthquakes and tornadoes should include locations of a safe room or areas and supplies that might be needed in an emergency, such as a portable radio or a flashlight. Be sure to familiarize yourself with the details of your facility's contingency plans for natural disasters. Most of us tend to think about risky professions like police work or armed guards when we hear about workplace violence. It may come as a surprise, then, that healthcare workers are among the most common victims of workplace violence. Contributing factors include interacting and caring for people that might be delirious from medications, have a medical condition, or they're in pain. OSHA defines it as any act or threat of physical violence, harassment, intimidation, or other threatening disruptive behavior that occurs at work. This could include situations like verbal threats or physical attacks by patients or their family members, a distraught family member who becomes verbally abusive or violent, a domestic dispute that carries over into the workplace, or coworkers bullying or hazing. While some healthcare workers may dismiss verbal abuse or disruptive behavior by patients and others as part of the job, this thinking can perpetuate the problem by preventing management from taking necessary measures to prevent future instances of violence and abuse. Surveys show only around 2/3 of physical and non-physical assaults are actually reported. Incidents of bullying and verbal abuse are even more underreported. Can't always prevent violence, but you can reduce the risk by planning ahead and being prepared to act swiftly to deal with threats, intimidation, and other disruptive behavior at an early stage. Workplace violence typically falls into 3 categories: disruptive, threatening, and violent behavior. Although disruptive behavior doesn't include physical violence, it can escalate into a serious situation if it's not dealt with appropriately. Respond quietly and calmly and try to diffuse the situation. Don't take the behavior personally, and ask questions when considering offering an apology, even if you haven't done anything wrong. If this isn't effective and the individual doesn't seem dangerous, calmly and firmly set limits. Ask the individual to stop their behavior and warn of official action, and if they continue despite warnings, ask them to leave the building. If you have to talk to someone that seems dangerous, make sure coworkers are nearby. Never isolate yourself. Try to use a calm, non-confrontational approach to diffuse the situation, and never touch the individual yourself trying to remove them. Even a gentle touch may be interpreted as an assault by an agitated person. Every situation can be different, so don't mention the police if you fear an angry or violent response. And of course, be ready to call 911 if the situation escalates or you ever feel concerned about your safety or someone else's. During certain emergency situations, including chemical, biological, or radioactive materials release, some weather emergencies with a threat of imminent danger, you may be directed to shelter in place rather than evacuate your building. Shelter in place means to take immediate shelter where you are, at work in our case, but it could be at home or another location. People tend to think that this means they need to stay exactly where they are and not move. That could actually put you in more danger, especially during a natural disaster like a tornado. To effectively shelter in place, you must first consider the hazard and then choose a place to shelter in the building that's safe. In general, though, sheltering in place is appropriate when conditions outside are unsafe and a higher degree of protection is available inside. Although the probability of you having to use any of the contingency plans we discussed are low, it's important to be prepared just in case. In order to reduce or eliminate the hazards of occupational exposure to bloodborne pathogens, your employer has set up an exposure control plan for the types of procedures you perform. This plan and a copy of the Bloodborne Pathogen Standard is located behind the red tab in your Osha Guard manual. The Bloodborne Pathogen Standard provides protection to employees with the risk of occupational exposure to blood and other infectious materials. This would include most clinical positions, but in some smaller practices, it might include non-clinical employees if they're asked to clean treatment rooms or help with patient care, even if it's in a limited manner. A risk determination is required to identify any positions with a risk of exposure. So what are bloodborne pathogens? They're microorganisms that may be present in blood or other bodily fluids and can lead to serious disease in humans. Bloodborne pathogens include viruses, bacteria, fungi, prions, or other microorganisms including parasites. HIV, hepatitis B, and hepatitis C are 3 of the most frequently addressed. Transmission of bloodborne pathogens can occur when you're stuck or cut with a contaminated sharp object, like a needle or scalpel, or have an open wound that comes into contact with contaminated blood or other potentially infectious materials. Human immunodeficiency virus, or HIV, is a virus that attacks the cells that help the body fight infection, making a person more vulnerable to other infections and diseases. HIV is transmitted in blood and certain bodily fluids of an infected person. This includes blood, semen, vaginal secretions, or breast milk. Other fluids like tears, saliva, sweat, and urine contain little to no virus and can't transmit HIV unless they're mixed with blood. Although HIV is a risk to you as a healthcare worker, it's important to know that it is primarily a sexually transmitted disease. It's a risk to individuals with multiple sexual partners and injecting drug users that share needles. Primary modes of occupational transmission include needle sticks or injuries with sharp contaminated items that lacerate skin, and through direct mucous membrane contact or non-intact skin exposures. HIV infection is generally a slow, progressive disease in which the virus is present throughout the body at all stages of the disease, and without antiviral therapy will progress through 3 stages. The initial stage of infection, which occurs within weeks, typically symptoms include flu-like symptoms, fever, diarrhea, fatigue, rash, joint pain, swollen lymph glands. These flu or mono-like symptoms generally subside within a few weeks, leading to the next stage, chronic asymptomatic infection, which means a long duration of infection without symptoms. Although the person appears to be healthy, they're considered to be HIV positive and capable of spreading the disease to others. The final stage is symptomatic infection, in which the body's immune system has been suppressed and complications have developed. This is referred to as acquired immunodeficiency syndrome, or AIDS. Infected individuals become susceptible to infections like pneumonia and various cancers. Hepatitis is an infection that attacks the liver. The word hepatitis actually means inflammation of the liver, and it's caused by a virus or even a toxin like alcohol when it's heavily abused. the three most common types being hepatitis A, B, and C. Hepatitis A usually comes from contaminated food or water, or from close contact with a person or object that's infected. Mild cases of hepatitis A don't require treatment. Most people who are infected recover completely with no permanent liver damage. On the other hand, hepatitis B and C are both considered a risk to healthcare workers under the Bloodborne Pathogen Standard, so let's take a little closer look at them. Hepatitis B is spread by contact with blood or bodily fluids of an infected person the same way as HIV. It's a resilient, highly contagious virus that can survive on a contaminated object and surfaces for 7 days. And according to the U.S. Department of Health, it's 100 times more infectious than HIV. According to the Centers for Disease Control, approximately 70% of people infected with hepatitis B virus will develop symptoms. If you do, they usually range from mild to severe and appear about 1 to 4 months after you've been infected. In some cases, though, symptoms have appeared as soon as 2 weeks after infection. Hepatitis B signs and symptoms may include abdominal pain, dark urine, fever, joint pain, loss of appetite, nausea, weakness, and the yellowing of the skin or jaundice. Most people are actually able to fight off a hepatitis B virus infection and clear the virus from their blood. However, 5 to 10% of adults will develop chronic infection, which can lead to liver failure, scarring, or cancer of the liver. In the United States, approximately 1.2 million Americans are chronically infected with hepatitis B, and about 5,000 die annually from hepatitis B-related liver complications. Fortunately, there's a safe and effective vaccine to protect against hepatitis B. According to the Bloodborne Pathogen Standard, your employer is responsible for providing the vaccination at no charge within 10 days of initial assignment of a job where there's a risk of occupational exposure. There are some exceptions, including already being vaccinated, maybe at a previous job, school, or during military service, if antibody testing reveals that you have immunity, or if the vaccine is contraindicated for medical reasons. All in all, though, it's a safe vaccination that's derived from yeast, not blood or blood products, so there's no risk of infection with HIV or other bloodborne pathogens. The vaccination is given in the deltoid muscle in 3 doses over a 6-month period. Current CDC recommendations for healthcare workers call for a titer 1 to 2 months after the 3rd dose to confirm antibodies. The Hep B vaccination is only about 90 to 92% effective, so up to about 10% of individuals will never develop antibodies. These individuals are considered to be non-responders. Individuals that are non-responders after the first series should repeat the series of 3 again, followed by another blood test to check for antibody conversion. The CDC only recommends a total of 6 doses or completing the vaccination series twice. If you still don't develop antibodies, you know that you're a non-responder and don't have immunity. Since your employer has an obligation to provide this vaccination, they might ask you to bring a copy of your vaccination record or sign the Hepatitis B Vaccination Acceptance Declination Form. This form allows you to declare and sign that you've been vaccinated, but without providing a vaccine record. Some records, like military and school vaccines, can be difficult to track down at the time of hire. If you're at risk or you have any questions about your facility's policies for hepatitis B vaccinations, talk to your safety and health officer. Hepatitis C is another bloodborne disease that's a risk to you as a healthcare worker. Like HIV and hepatitis B, it's covered under the Bloodborne Pathogen Standard because it's transmitted through direct contact with contaminated blood and other potentially infectious materials. Although the symptoms of hepatitis C are almost identical to hepatitis B, only about 15% of infected individuals actually show signs or symptoms. Most cases of acute hepatitis C are asymptomatic, meaning people don't notice the symptoms. The other noticeable difference is acute hepatitis C tends to develop into chronic hepatitis C. In many instances, people with hepatitis C don't become aware of it until the infection is advanced. Approximately 75 to 85% of adults infected with hepatitis C develop a chronic infection according to the Centers for Disease Control, and unlike hepatitis B, there isn't a vaccination currently available. According to Health and Human Services, more than half the people living with hepatitis don't know that they have the virus. These individuals are at risk for life-threatening liver disease and cancer, and unknowingly transmitting the virus to others. We already covered that your employer has an obligation under the Bloodborne Pathogen Standard to protect any employee who might come into contact with blood or other potentially infectious materials as a result of doing their job duties. One simple but effective concept is a method of infection control known as universal precautions. Treat all blood or bodily fluid like they're infected with HIV, hepatitis, or another infectious pathogen. In other words, universal precautions assumes that all bodily fluids are dangerous. Consider the sheer numbers of people that are infected with hepatitis and don't know it. If they're unaware or they think they might be discriminated against or treated differently, they might not disclose that they have a bloodborne disease in the first place. Universal precautions should be practiced on all patients at all times. Personal protective equipment, or PPE, is specialized clothing or equipment that's used as a barrier to protect you against blood or other potentially infectious materials. This includes gloves, masks, eye protection, barrier garments, pocket mouth-to-mouth resuscitation, or other ventilation devices. In other words, whatever's required to protect you from the possible exposure to bloodborne pathogens. Your employer has the obligation to make appropriate PPE readily available at no cost to you. The personal protective equipment must be fitted properly and address any personal requirements like a latex allergy. Keep in mind, this is personal protective equipment as it relates to the Bloodborne Pathogen Standard. Every facility's risk of exposure will vary depending on the types of procedures you do. Your safety and health officer has determined the minimum required PPE for the tasks you perform. This page is located in the exposure control section of your Osha manual. This is the schedule of minimum required PPE for the tasks you perform. Your employer has a responsibility to not only establish the minimum to keep you safe, but to enforce that it's actually worn. So set realistic PPE requirements. Most procedures will be gloves only, but if there's a chance of splatter or splashes, or it's an aerosol generating procedure, additional personal protective equipment would be necessary to keep you safe. Keep in mind, these are minimum requirements that your employer has established. You always have the option to wear additional PPE if you feel a situation or procedure calls for it. If you have questions about your facility's policies on personal protective equipment, talk to your safety and health officer. Engineering controls include all control measures that isolate or remove a hazard from the workplace. In medical and dental settings, examples might include sharps containers or recapping devices. The original Bloodborne Pathogen Standard wasn't very specific regarding the applicability of various engineering controls. On January 18, 2001, OSHA published a revised Bloodborne Pathogen Standard to reflect the changes Congress specified in the Needle Stick Safety and Prevention Act. In addition to the original standard, the revised standard expanded the definition of engineering controls to include devices with engineered sharps injury protection and needleless systems. It also requires you to solicit input from non-managerial and frontline workers for the identification, evaluation, and selection of these devices and other engineering controls. Review and update your exposure control plans to reflect changes in technology that eliminate or reduce such exposure and document their consideration and implementation if they're deemed appropriate. Maintain a sharps injury log of percutaneous injuries with information on the type and brand of device involved, the department where the incident occurred, and an explanation of the incident. Safe needles and devices have built-in safety control features to help prevent injuries before, during, and after use through safer design. Certain factors need to be taken into consideration when evaluating safety needles. Obviously, it should be safer than what you're currently using, and it shouldn't make a procedure more difficult or cause patients more discomfort. In the back of your OSHA Guard manual, you'll find a form to document any needles or devices you evaluate. This form asks a series of questions that will help you to determine if the device is suitable for your needs. Although these can be done individually, it's also okay to list a few names together if the evaluation was done collectively. These are just a few of the questions that will help you to determine if the device is appropriate for your use. Be sure to document and keep these evaluations. Try to keep an open mind too. A lot of people feel that they don't need a change just because there hasn't been a needle stick injury or exposure. But look at it like a seatbelt law. Regardless if you're a safe driver or never had a speeding ticket, you still might get cited if you weren't wearing a seatbelt in a state that mandates their use. OSHA requires these evaluations, but also implementation. In other words, don't evaluate a product, determine that it's great, safer alternative, and then not implement it just because you have documentation. On the other side, there are specialties and procedures that can make implementation difficult or possibly even more unsafe. Dentistry is a good example, pediatric dentistry even more so. It's a very small, confined area, and sometimes safety features can cause additional patient discomfort or make maneuverability of the device difficult. If you're not using safety needles, use a form to explain why something's not appropriate for your use. This must be an ongoing process. Evaluations must be documented at least once per year. Technology improves, so make sure you ask your vendor or reps for any samples of the latest needles available. Now, if you aren't using needles with built-in and safety features, it's important to use a combination of work practice and engineering controls to reduce the possibility of exposure. You shouldn't recap needles if you don't have to. But if it's required, never use a hand-to-hand method. The single-hand scoop method is the best way to recap if an engineering control like a recapping device isn't available. If they are, recapping devices are a great way to prevent needle stick injuries. They're a mechanical device that allows you to recap, but it keeps your hand safely away from the needle or behind the needle. OSHA requires that work surfaces be cleaned with an appropriate disinfectant. This statement is important because some products work well for one situation, but not necessarily another. COVID-19 is a perfect example. Clorox and Lysol wipes are great for high-touch areas, but bloodborne pathogens are resilient and require specialized disinfectants. Disinfectants that are used in healthcare and dental settings should perform two important functions. They should be bactericidal, which means they kill harmful bacteria, and fungicidal, which means they kill fungus. Cleaning frequency and methods will vary according to the area in your facility, the type of surface to be cleaned, and the amount and type of soil present. So what's the difference between cleaning, disinfection, and sterilization? Cleaning refers to the removal of visible soil and organic material from objects by washing or scrubbing with water and detergents, or soaps and rinsing with water. Thorough cleaning is normally required before disinfection or sterilization on visibly contaminated surfaces because organic material can decrease the effectiveness of those processes. A detergent is a cleaning agent that doesn't claim to kill microorganisms. A disinfectant is a chemical or a physical agent like UV light that kills microorganisms but not all bacterial spores. There are 3 levels of disinfection: high, intermediate, and low. High-level disinfection kills all vegetative microorganisms, mycobacteria, lipid and non-lipid viruses, fungal spores, and some bacterial spores. Intermediate-level disinfection kills mycobacteria, most viruses and bacteria, and is registered by the Environmental Protection Agency as tuberculocidal. Low-level disinfection kills some viruses and bacteria. Sterilization refers to the complete elimination of all forms of microbial life, including bacterial spores. Objects can be sterilized by a physical process like an autoclave or by using certain chemicals. The disinfectants you use on surfaces in your work area, like exam rooms, operatories, treatment areas, and other areas that might be contaminated with blood or other potentially infectious material, need to be EPA registered and have the following statement in bold letters. Be sure to consult and review the manufacturer's instructions for contact times and other pertinent product information. Although we've discussed ways to help minimize the likelihood of exposure to blood, you still have a job that comes with the risk of occupational exposure. If you experience a needle stick or sharps injury or were exposed to the blood or other bodily fluid of a patient, it's important to immediately wash with soap and water or flush the affected area and let your safety and health officer know right away. You have the right to medical attention and certain forms have to be completed. If known, the source patient needs to be asked if they will consent to a blood test. This is a requirement under the Bloodborne Pathogen Standard. This is important. Injuries oftentimes happen when you're cleaning up after a procedure and when the patient is checking out. If you talk to them before they leave, you have a much better chance of getting their consent and knowing the results within weeks. Ideally, you and the source get tested. These results are kept confidential and normally provided to you within 2 weeks of testing. If the source patient's blood comes back negative, that's the extent of testing. If the source is unknown or they don't consent, testing is normally carried out over a 6-month period. The baseline and a follow-up at 6 months. The healthcare professional that you see will ultimately determine the actual course of action based on current CDC recommendations, the type of injury, and your vaccination status. For example, a needle stick injury involving a large bore needle and a high-risk patient might warrant post-exposure prophylaxis or more than one follow-up test. Your safety and health officer will fill out any forms that are required. They should be completed as soon as possible after an exposure incident. These forms are important and become part of your employee medical record. They document the exposure in the unlikely event you have complications down the road, but it also provides management a way to analyze injuries and the types of devices that are causing them and determine if they could be reduced or prevented. You can see detailed steps to take following a needle stick injury or exposure on pages 15 through 19 of your exposure control plan. If you have questions about your needle stick injury protocols, talk to your safety and health officer. We've already discussed bloodborne pathogen exposure control, but what about other infectious diseases like tuberculosis, MRSA, and even new and emerging diseases like COVID-19? The Bloodborne Pathogen Standard has been really effective at protecting healthcare workers from bloodborne pathogens, but it doesn't address infectious diseases transmitted by other routes. Osha is expected to modify or create a new standard to address these risks, but currently uses a combination of the Personal Protective Equipment and Respiratory Protection Standards and the General Duty Clause. Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2 is the virus. COVID-19 is the disease. For simplifying this training, we'll refer to it as COVID. COVID affects different people in different ways. Infected people have a wide range of symptoms reported, from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure. People with these symptoms may have COVID-19. Fevers or chills, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion, nausea, and diarrhea. While more is learned every day about COVID and the virus that causes it, there's still a lot that's unknown. According to the most recent CDC data, COVID is spread more like most other common respiratory viruses, primarily through respiratory droplet transmission within a range of less than 6 feet. There's no evidence of efficient spread to people far away or who enter a space hours after an infectious person was there. According to the Centers for Disease Control, diseases that are spread efficiently through airborne transmission tend to have a high transmission rate because they can quickly reach and infect lots of people in a short period of time. We know that a significant portion of COVID infections, estimated about 40 to 45%, occur without symptoms, and that infection can be spread by people showing no symptoms. Thus, where COVID spread primarily through airborne transmission like TB, experts would expect to have observed considerably more rapid global spread of infection in early 2020 and higher percentage of prior infection measured by serosurveys. Existing interventions to prevent the spread of COVID appear sufficient to address transmission both through close contact and under the special circumstances favorable to potential airborne transmission. Among these interventions include social distancing, the use of masks, hand hygiene, and surface cleaning and disinfection. Ventilation and avoidance of crowded indoor spaces are especially relevant for enclosed spaces where circumstances can increase the concentration of suspended small droplets and particles carrying infectious virus. Once again, your risk of exposure will vary with your specialty and the types of procedures you do. Your employer has implemented safeguards based on your risk and the most recent CDC recommendations. The term airborne can be used to describe any size particle capable of traveling through the air. For respiratory droplets, that can include droplets that are close to the source and those that have moved farther away. However, most infectious disease and public health experts reserve the term airborne specifically for use in the context of airborne transmission to describe infections capable of being transmitted in the air over long distances and that persist in the air for long periods of time. Tuberculosis is an airborne disease that could present a risk to some healthcare workers. Your degree of risk will vary depending on the types of patients you see and the procedures you perform. Most healthcare and dental facilities will be classified as low risk. If your facility doesn't admit or treat patients with active tuberculosis, you're not required to have specialized engineering controls or personal protective equipment. According to the Centers for Disease Control data, annual TB rates in the United States have declined dramatically during the past 3 decades. In 2020, the rate dipped to 2.7 cases per 100,000 people. Active TB typically causes many symptoms that are most commonly related to the respiratory system, including coughing up blood and sputum. You may experience a cough that lasts for over 3 weeks and pain when coughing or with normal breathing. Other symptoms include unexpected fatigue, fever, night sweats, loss of appetite, and weight loss. If a patient admits having active tuberculosis or you suspect that they might be infectious, they should be referred to a local admitting facility that is equipped to deal with TB. Treatment should be deferred until the patient is no longer infectious. Some larger facilities, pulmonary infectious disease specialists, and any other specialties that admit and treat patients with TB obviously have a higher risk of exposure. These facilities would be obligated to provide routine testing, specialized personal protective equipment, and fit testing on a routine basis. If you have questions about TB, site-specific policies, or testing, talk to your safety and health officer. In 2012, Osha began to revise the Hazard Communication Standard to be consistent with the United Nations Globally Harmonized System of Classification and Labeling of Chemicals. The Globally Harmonized System, or GHS, is an international approach to hazard communications that provides specific criteria for the classification of chemical hazards and a standardized approach to label elements and safety data sheets. Since the United States is both a major importer and exporter of chemicals, it was common to see labels and safety data sheets required by other countries. Even the defining properties like the exposure limits or flash points of a chemical weren't consistent. A product might be considered flammable or toxic in the United States, but not in the country it was imported to or exported from. OSHA defines a hazardous chemical as any element, chemical compound, or mixture that is a physical or health hazard. OSHA's Hazard Communication Standard requires your employer to train you to recognize chemical hazards using the information provided on product labels and in safety data sheets to take the necessary precautions to protect yourself. This plan shows how hazard communication compliance is actually achieved in your facility. It's located behind the green tab in your red OSHA Guard manual. It lists the hazardous chemicals in your facility and describes how your employer will use safety data sheets, labeling, and training to inform you about chemical hazards and precautions to stay safe. You're required to have safety data sheets for every hazardous product that you have in your facility. SDSs, formerly known as Material Safety Data Sheets or MSDSs, identify the hazardous properties of chemicals that may pose a health or physical hazard, and they provide you with guidance for appropriate protective measures. SDSs are available to you anytime during business hours and are usually kept in a binder with your OSHA manual or on a computer. Either way, you must be able to obtain the information immediately, especially in an emergency. If you keep them electronically, they must be available offline and not contingent on internet access. If you order a new product, it's important to request the safety data sheet and add it to your hazardous chemical master list. The master list is like a table of contents that lists all the products in your binder or file folder. So why reference a safety data sheet? If you work with a product and there's an exposure or a spill, or maybe something makes you feel nauseous every time you use it, That's why these sheets are here. If you have any questions or concerns about the products you work with, access them anytime during business hours. Although SDSs might look different from manufacturer to manufacturer, they contain the same information in a uniform 16-field format. In addition to safety data sheets, you have the obligation to make sure chemicals are properly identified. Although the system for labeling has changed, the fundamentals haven't. If a product is in its original packaging, it's up to the manufacturer to identify it and convey the hazards. If you remove or transfer that product to a different container, then you have the responsibility to identify the contents and hazards according to the revised standard. Labels now have 6 standardized elements: product identifier, pictogram, signal word, hazard statements, precautionary statements, and manufacturer information. For what it's worth, all 6 elements can be found in the first 2 sections of any safety data sheet. Because the Hazard Communication Standard requires a decent amount of information, it's okay to utilize backsplashes and placards if necessary. Just make sure the labeling is clearly associated with the product. This hazard rating chart, or one like it, should be posted somewhere in your facility. It explains the rating system used under the Hazard Communication Standard aligned with GHS. It also gives a visual reference for safety data sheets in label format. Pictograms are an important component of your hazard communication program. They're a visual representation of the chemical hazard classification, and they're used on safety data sheets and product labels. The 9 pictograms used to convey hazards under the Hazard Communication Standard are flame, exclamation mark, skull and crossbones, health hazard, corrosion, flame over circle, gas cylinder, exploding bomb, environment. These pictograms represent a physical, health, or environmental hazard. OSHA doesn't enforce the use of the environmental pictogram since that doesn't impact employee safety, but it shouldn't be overlooked since federal, state, and local authorities might require specialized disposal. So for a quick summary, have safety data sheets available for all the products that you could be exposed to. Label any product you remove from its original container or transfer from its original packaging. And most importantly, talk to your safety and health officer if you have questions about your hazard communication policy. Regulated medical waste, commonly referred to as biohazardous, infectious, or medical waste, is in simple terms any waste that may be contaminated by blood, body fluids, or other potentially infectious materials. The Bloodborne Pathogen Standard uses the term regulated waste to refer to the following categories of waste. Keep in mind, OSHA's function is regulating employee safety, so their standards center around handling medical waste safely. The disposal of medical waste is done in accordance with applicable state regulations. These rules are typically published by your state's Environmental Protection Agency or Department of Health. For the most part, medical waste generated in your facility will fall into 2 different categories. Sharps waste includes items like needles, lancets, scalpels, exposed ends of dental wires, staples, and broken glass. Pretty much anything contaminated with blood or other potentially infectious materials that can puncture or lacerate your skin. Red bag waste are soft waste items saturated or visibly contaminated with blood or other potentially infectious materials. This would include items like bandages, gauzes, plastic tubing, cotton rolls, and visibly contaminated personal protective equipment. All other wastes, like most gloves, table paper, patient bibs, and gauze that's not bloody or saturated, isn't regulated and can usually be disposed of with regular trash. Keep in mind the term saturated is subjective. If there's any doubt, err on the side of caution. Regardless of its category, medical waste should be segregated and disposed of as close as feasible to the area where this waste was generated. This is referred to as point of origin disposal. Sharps should be placed immediately into a puncture-resistant, leak-proof container. Make sure the lid is securely fastened and the opening and the biohazard label and fill line are clearly visible and orientated in the same direction. If they're wall-mounted, make sure they're at a comfortable height for everyone that has to use them. Pay attention to the fill line. When sharps reach this line, the container must be sealed and disposed of according to your state's regulations. Soft waste is disposed of into red bags. These bags are identified with the biohazard symbol and designed to be resistant to punctures, tears, and leaks. Just like sharps containers, they should be located as close as possible to where you're actually generating waste. Red bags should also be replaced more often than sharps containers. Absorbent materials saturated with blood and other potentially infectious materials are much likely to smell and be unsanitary. Tie or seal these bags at the point of origin and bring them back to your final destination storage area. It's important to be familiar with the disposal requirements in your state. States often require a licensed transporter and require scheduled pickups. Other states actually let you treat and dispose of your own waste using isolyzer or other approved methods. Regardless, it's important to keep transporter receipts or logs documenting the safe treatment and disposal of these regulated wastes. You can do an internet search for medical waste regulations in my state, or visit your state's portal here. Although a spill of blood or other potentially infectious materials is unlikely, you have a contingency plan for spills. If you have a red OSHA manual, it's located behind the orange medical waste tab on page 6 of your plan. Depending on your size and specialty, you might have a spill kit to clean up bloodborne pathogens. If you do, be familiar with its location. You can also assemble your own kit or use supplies that are readily available. Most facilities will have the recommended materials on hand. The recommended components for a kit to respond to a small blood spill include gloves, eye protection, red bag, hospital-grade disinfectant, absorbent materials like paper towels or kitty litter. Even an extra sharps container and a broom and dustpan are usually available in most facilities. Like any exposure risk, it's important to select the appropriate personal protective equipment. Although most spills might only require gloves and eye protection, additional PPE is always available. If there's broken glass, it's important to remove it first. Have a sharps container ready and use a broom and dustpan or forceps to safely remove the broken shards. Cover the blood spill with paper towels or another absorbent material to soak up as much blood as possible. Keep in mind that the disinfectant won't work if the blood still covers the surface. Dispose of these absorbent materials into a red bag. Pour a hospital-grade disinfectant over the area and allow it to sit for the recommended contact time. If it's an absorbent surface like carpet, it's advisable to steam clean it if possible. All disposable personal protective equipment and cleaning materials should be disposed of into a red bag. And finally, wash your hands. With that said, this concludes my role in your OSHA training. If you have questions about your policies, talk to your safety and health officer or reference your OSHA Guard manual. Thanks for watching.